Yeah, and to go back, you think about it, COVID happened. Once COVID happened, it really limited the amount of offices that you could go into, um, the access to care. So what happened is in the mental health, behavioral health, telehealth spaces, everybody had to have licenses. They wanted to practice in all the 50 states. We wanted to make care more accessible because COVID closed a lot of things down. So thinking about that, if you're in a whole bunch of neighboring states and you have, say, an on-call person that does telehealth because they go into an emergency room after hours, or say like you don't have the funds to be able to go into an emergency room, and you're like, hey, I looked at the back of my insurance card and I can do telehealth and it's not that much of my deductible. I want access to that. How are we screening these mental health, telehealth, behavioral health? Are we checking all of the states that they lived in or that they could potentially work in to go along with what Amy said?
Then I would say on the criminal side, there's two things that we're seeing. First relates to federal crimes. So there has been a significant increase in focus from the federal government to crack down on fraud, waste, and abuse in the healthcare space. And we are seeing an increase in the number of federal criminal cases being brought for healthcare fraud. So many people in their programs are only looking at a state and local criminal check, and we really would recommend federal to be brought into that because a federal case does not get brought at that level. And if you're missing it from the program, you would be unaware of new healthcare fraud related cases. And the second one relates to state and local monitoring. With social media right now, it's becoming more and more clear, different organizations, the type of monitoring program they're using for their team members and individuals. And what they're sharing now is, hey, if I work for company X, they will only do a background check for you once a year to find the prior year criminal cases. And when an individual is aware of that and knows I committed a crime and I've got 6 months left before my next check, it gives them a very clear window of where they could commit additional fraud, waste, and abuse prior to be getting caught and removed from that program. So having that monitoring program not to be fixed on like an annual check, but to have a continuous monitoring solution. So as crimes are committed, filed with the courts, that organization is made aware of that and then can take the correct actions based on their risk.
Absolutely, Tom. I'm going to add one thing to that. I think, the monitoring component really is key, not just on the criminal monitoring side of things, but thinking about even, historical credentialing processes. Organizations typically credential a provider one time when they onboard them or contract with them, and then they re-credential them 2 or 3 years later. But what we know and what we see is changes in licensure, risk to a patient, adverse actions coming up, board actions coming up, malpractice cases coming up in that 2 or 3 year period. And so monitoring, from a practice perspective, we see that as where the industry is moving and moving aggressively. So it's not enough now to just check a provider and then check them again, especially where there are organizations that can make this data available and more readily available and more actionable early. So I think we're seeing the same thing on the monitoring component that y'all are on the criminal side.